Good afternoon, doctors. We are from Small Group Discussions B5, and we will present to you the Epidemiology, Screening and Diagnostic of Cancer as our student project. The name of our small group discussions member are shown on the screen. The presentations will be continued by my partner.
Good afternoon, my name is Philbert Purbowo and the last 3 digits of my name is 148. Cancer has various names. It can be called neoplasm or malignant tumors. It generally refers to a group of diseases which may affect any organ or tissue in the body. It's a condition where cells replicate or grow very quickly, uncontrollably, and it's abnormal. This leads to a process in which cells can grow beyond the normal boundaries and invade other body parts. This can happen through the spreading to other organs nearby relating to the starting location. This process is known as metastasizing, and this is the leading cause of death in cancer. The cancer itself is the second leading cause of death globally. It causes up to 1 in 6 deaths in 2018. The cause may vary, but as I mentioned before, it would commonly be caused by metastatizing. Amongst men, the most common types of cancer are lung, prostate, colorectal, stomach, and liver cancer, while amongst women, the most common types of cancer are breast, colorectal, lung, cervical, and thyroid cancer. That's all from me. Thank you.
My name is Anindita with last 3 digit of cell number is 159. Problem raising from the presented background can be formulated as follows. 1. What is the definition, epidemiology, and etiology of cancer? 2. What are the characteristics of cancer? 3. What are the screening tools for cancer diagnosis? 4. How to manage cancer? And the objective of this literature include 1. Understanding the definition, epidemiology, and etiology of cancer. 2. Identifying the characteristic of cancer. 3. Identifying the screening tools for cancer diagnosis. 4. Understanding the management of cancer. This review helps to allow a better understanding of cancer, especially in the term of epidemiology, screening, and diagnosis of cancer, to assist in the identification and management of cancer, as well as providing knowledge regarding the disease which can be used for further research.
Thank you, Doctor and the moderator. Firstly, let me introduce myself. My name is Komang Chandra Yogananda, with last 3 digit number is 091. So in this section, I will explain about the definition and the epidemiology of cancer. So what is cancer? Cancer is uncontrolled cell growth and genetic mutation. In globally, it accounted for 90.6 million deaths in 2018, posing significant health challenges. The epidemiology of cancer is show fluctuation in cancer incidence, prevalence, and mortality of globally. In 2020, 19.3 million new cases and 10 million deaths emphasize the urgent needs for effective prevention and control. That's all from me. Thank you.
Next, I'd like to discuss about the etiology of cancer. DNA mutation in cells lead to uncontrollable cell proliferation, which in this case, the malignant tumor cancer. However, it is important to know that the mutation itself is multifactorial. Normal cells are exposed to carcinogens, inflammation, or have inherited mutational genes that cause defects in the expressed protein, for instance, the tumor suppressor gene. Thus, the abnormal cell will not halt its mitotic phase and continue to proliferate. In addition to that, the pro-inflammatory factors also support the recovery and regrowth of these cells till eventually these cancer cells invade other tissue. There were several risk factors that could add up the tendency of someone having cancer, also certain conditions which impact the prognosis later on. The first one would be genetic factors, which clearly means that someone is inherited with oncogenes or has mutational genes that can cause defects leading to cancer. The second one is modifiable risk factors, in this case, lifestyle changes. Last but not the least is environmental factor. For further details, it can be seen through this slide.
Hello everyone, let me introduce myself. First, my name is Komang with the last digit number of 224. And now I will tell you about pathogenesis of cancer. First, pathogenesis of cancer is the process of cancer which involves several stages ranging from the endemic to cancer cell growth. The endemic can occur due to environmental factors such as exposure to radiation of chemical. or genetic factors such as certain gene mutation. Abnormal cells that continue to grow and develop then from malignant tumors of cancer. The pathogenesis of cancer can vary depending on the type of cancer that occurs. The pathogenesis of breast cancer involves risk factors such as family history, age, and hormone exposure. The pathogenesis of cervical cancer involves infection with the HPV virus. And the pathogenesis of lung cancer involves exposure to harmful substances such as cigarettes. Thank you.
For lung cancer screening, we can use low-dose computed tomography for high-risk populations like current smokers. The effective dose is 2 millisievert and it is aimed for non-calcified pulmonary nodules. The size of the nodules determine the prevalence of malignancy. For cervical cancer screening, we can use the standard pap smear, visual inspection with acetic acid and low-dose iodine, liquid-based cytology, and HPV testing. Where the World Health Organization recommend to use cytology and HPV DNA-based test in women starting the age of 30. Both the HPV testing and conventional cytology detect cervical intraepithelial neoplasia. For breast cancer screening, we can use mammography. It uses X-ray radiation, a type of ionizing radiation, to produce diagnostic images. For colorectal cancer screening, we can use colonoscopy, sigmoidoscopy, and stool test, while colonoscopy and sigmoidoscopy can also help to stop the disease from progressing, because abnormal colon growth or polyps can be detected by these tests and removed before they develop into cancer. There are other cancer screening tests available, such as prostate-specific antigen tests for prostate cancer screening, skin exams for skin cancer, multi-cancer detection, and more.
Okay, so next the clinical manifestations. In the initial stages, cancers typically show no symptoms. As cancers progress, they create symptoms by disrupting the normal functioning of the affected organ or structure. Some potential symptoms of cancer can include alterations in the breast, changes in bladder functions, alterations in bowel movement, difficulties related to eating, changes in the mouth, neurological issues, skin alterations, and also unexplained symptoms such as weight gain, weight loss, fever, or night sweats.
Thank you for the time. My name is Nathanael from Monika with last digit number 077. I'm going to talk about the diagnosis. According to the National Cancer Institute, imaging procedures that are medical tests that produce internal body images to aid in tumor detection. These tests include CT scans, MRIs, ultrasounds, and PT scans. Biopsy is an essential stage in verifying a cancer diagnosis, entailing the extraction of an abnormal tissue sample for microscopic examination. The findings are documented in a pathology report, providing crucial insight into the diagnosis and informing treatment choices. Next will be continued by my colleague.
Hello, my name is Ananda Aulia. With 3 last digits of my student ID number is 015. Now I'll present you about the complication. The first one is metastasis. Metastasis heralded as a defining characteristic of cancer. The term metastasis originating from the Greek word displacement, it describes the migrations of cells from the primary tumor to the other area of the body, leading to the development of new tumors, a major contributor to cancer-related death. The second one is treatment side effects. Cancer treatments can be classified into prophylactic or preventing the cancer from coming back after surgery, or therapeutic, aimed at treating the disease. Chemotherapy works primarily in reducing the size of the tumor, while immunotherapy seeks to awaken and boost the body's natural defense to combat cancer. The last one is viral infection. Viruses have been linked to cancer through the production of reactive oxygen species, ROS, produced by inflammatory cell as well as epithelial cell. Owing to their ability to disrupt signaling pathway responsible for inducing oncogenic transformation, mainly in their efforts to support their own reproduction or infection, along with the viral integration, viruses influence the development and survival of many different types of cancers found in humans. That's all from me. Thank you. Next slide, please.
Okay, thank you for the opportunity. My name is Dinaria Sakura Kirani. With the last 3 digits of my student number is 055, and I will present to you the management of cancer. The first one is chemotherapy. Chemotherapy uses cytotoxic or anti-cancer drugs that are systemic. The goal of chemotherapy is to treat or slow the growth of the cancer cells. The second is radiation therapy. Radiation therapy using high wave rays such as X-ray and gamma rays. The goal of radiation therapy is to kill cancer by damaging the DNA of the cells. The third is immunotherapy. It involves various types of immunotherapy agents that have been modified to stimulate the body's immune system, and the goal is enhance the body immune system and respond to recognize and fight cancer cells more effectively. And the fourth is surgery. Surgery is a procedure to remove as many abnormal cells as possible. Okay, the presentations will be continued by my partner. Thank you.
My name is Putu Anindita Wira with my last 3 digit of ID number being 185. So for the prognosis, the factors influencing prognosis are the nature of the malignancy and its location within the body, the cancer stage, the grade of the malignancy, specific characteristics of the cancer cells, the patient's age and pre-cancer state of health, and lastly, the patient's reaction to the treatment received. And for the types of statistical methods to estimate prognosis, are survival specific to cancer, comparative endurance, survival free from disease. A cancer cure is achieved when all signs of the disease disappear following therapy and the disease never returns. On the other hand, remission denotes a decrease in your cancer symptoms and indicators. Partial or total remission is possible. All indications and symptoms of cancer have vanished in a full remission. Certain medical professionals have declared you are cured if you have a complete remission for 5 years or longer. Even so, some cancer cells may continue to exist in your body for a long time following treatment. One day, these cells might lead to the cancer returning. The majority of cancers that recur do so within the first 5 years following treatment. However, the cancer may return at a later time.
Okay, allow me to introduce myself. My name is Justin, with the last 3 digits of my name being 106, and I'll be explaining about the conclusion. So, in conclusion, cancer is a very complex disease characterized by multiple aberrant cells throughout the body. The clinical manifestations of cancer largely vary depending on the type of cancer a person is suffering from. So, there exist many methods to screen for cancer, such as LDCD for lung cancer, pap smear for cervical cancer, and mammography for breast cancer. And currently, the methods for treating cancer are limited and heavily dependent on the type of cancer. So, but some common treatments used today are chemotherapy, immunotherapy, surgery, and radiation therapy. So that's all for me. Thank you.
Okay, I think that's all the presentations from our small group discussions, and we would like to say thank you for the attention.